So you've been to a whole bunch of therapists, and the first one said it was trauma, and then another one said, well, maybe BPD, and your therapist now is saying, gosh, could it be autism? And you're wondering, oh my gosh, I don't know what the heck any of it is. So this video is for anyone who's kind of caught between this label war and is asking, what's really going on with me? Because I know that depending on what's really happening, it can help me choose the right treatment. So confusing because these diagnoses can often overlap. Sometimes they come with emotional flooding, shutdowns, chronic self doubt, relationship difficulties. It's common in all three of these diagnoses. And when people, especially women and assigned female at birth folks, learn to mask their distress, clinicians may default to a borderline personality diagnosis, especially when the pain shows up within relationships. And one of the things I'd like you to think about is what seems like emotional chaos could actually be your nervous system doing exactly what it needed to do at the time to survive. Now, I totally understand. We want people to learn skills, to learn to manage these emotions so they can reach their long term goals. But sometimes the first step is teasing out exactly what the diagnosis is, because diagnosis is often paired with type of treatment. So let's jump into a trait by trait comparison of each diagnosis. So, the first trait I want to look at is emotional reactivity. Now, with BPD, we're going to have rapid shifts in emotions. And often these are going to be triggered by relationships. This is going to be, somebody looked like they were judging me, and that makes me feel really awful and icky, and I feel very strongly about it. Or someone didn't respond to me in the way that I would had hoped, or someone had criticism for me, and I feel a lot of strong emotion about that. Now, with autism, we're going to have emotional reactivity that's more sensory triggered, more just too much, too many voices, too many sounds, too many textures, too much, too much, too much, too much, right? And for CPTSD, we're going to have trauma triggered flooding. It's basically the idea is that somehow on some level I'm reminded of a trauma by that, and then I'm going to kind of have a strong emotional reaction that may lead to shutdown. The next trait I want to look at is identity struggles. So for BPD, we're going to see kind of a self concept that is a little bit unstable sometimes. For autism, we're going to see masking. I want to look like how other people do it. I don't want to be picked out as strange or unusual. Sometimes I might be confused about the interactions that are going on around me or what the expected behavior is. And with complex PTSD, we might see what we kind of call trauma driven self erasure. I'm going to be kind of invisible or be who you want me to be so nothing bad happens. Our next trait is going to be social challenges. How do social challenges show up typically in each diagnosis? So, for borderline personality disorder, we have kind of an intense fear of abandonment for most folks, a fear that I'm unlovable, that I'm unwantable, and I don't want to be alone. Desperately, I don't want to be alone. For autism, we've got social decoding difficulty, that idea of being able to read the social cues, understand what the behavior that's expected from me, and what are other people attempting to get across to me. And for complex PTSD, we've got that hypervigilance that goes with trauma and difficulty trusting people, because often people with complex PTSD were hurt by the people that they're supposed to be able to trust the most. The last trait I want to take a look at are shutdowns or meltdowns. Now, with borderline personality disorder, sometimes it can be outbursts. It can be, I'm going to go off on you. Other times it can be impulsive behaviors intended to bring the emotion down in the moment. That can include suicidality or self harm behaviors. Now, with autism, we have sensory or social shutdown, just that I can't take one more thing going on right here, right? So I've just got to cool it down and just stop. And for complex post traumatic stress disorder, we've got numbing or freezing or dissociation, that kind of just like, I'm going to clock out here. This is too much for me to handle. I'm going to go away. I'm going to go to my happy place, not necessarily a happy place to be there, but I'm going to go someplace where I'm back away from this in my mind. So here are a couple of really, really, really overgeneralized, simplistic examples, but they might be helpful. In borderline personality disorder, you've got one mistext and you start to spiral emotionally. Maybe they hate me, or maybe they're off talking to somebody else, that kind of thing. With autism, loud room, too many faces, and your system starts to shut down. And with complex PTSD, a raised voice makes your brain hit the emergency brakes. Oh my gosh, what is happening here? Am I safe? So that's what you want to think about when you're looking at the differences here. If you're thinking, oh my gosh, I relate to all of these, that's not uncommon. How to tell the difference a little bit more is to think about that the symptoms might look similar. But another clue that might be helpful is where they came from and how those symptoms kind of respond to stress. So, with borderline personality disorder, we often start to see it kind of in early adolescence, and the emotional intensity tends to spike when connection with others feels threatened, or getting a message that feels like your emotions are invalid, wrong, or weird. Now, with autism, of course, we've got a lifelong brain difference. And folks who, oh, I hesitate to use the phrase higher functioning, but folks who are a little less impacted by autism often get really good at masking that difference. And the triggers are sensory, or they can be unpredictable social situations, not knowing what's expected or what's going to happen in a particular situation. And with complex PTSD, this tends to come from prolonged trauma, and especially neglect or emotional abuse. The brain becomes wired to kind of expect danger, even in safe moments. You're always waiting for that other shoe to drop. So, thinking about why your symptoms exist and what they're trying to protect you from can be another clue towards diagnosis. Now, can you have more than one? Oh my gosh, yes, absolutely. You might be autistic and have suffered trauma. You might have BPD and neurodivergency and carrying trauma. The idea here is not to make a sudden shift in therapy because you watch this video. The idea is to bring it up to your mental health professional as an avenue to explore. I have often been incredibly grateful to my clients over my 25 plus years of being a therapist when they bring up something and they say, hey, I saw something that rang true. Can we bring this up and talk about it and try to figure out if that's a piece of my puzzle here? And I go, oh my gosh, yes, let's take a look because we're a team. I'm not the absolute authority, right? And I'm going to tell you what you have. We have to communicate. We have to work together to figure out the best treatment plan. And again, treatment plan often flows through from diagnosis. So, what actually helps here now that we have a better idea of where these different traits align to which diagnosis? Well, the first thing I want to encourage you to do is a comprehensive assessment, especially neurodiversity informed, to get clear on those overlapping traits. Now, the other thing is DBT skills. They can help manage relational triggers, self validation, other behavioral issues that get in the way of what you really want. For autism, we've got sensory regulation tools that help with that sense of overload. But also, we've got neurodiversity focused DBT. Lots and lots and lots of DBT providers are getting trained up in helping neurodiverse clients be able to use skills more effectively. And for the complex PTSD symptoms, we've got trauma informed therapy to help work through that freeze and dissociation pattern. I am absolutely not encouraging you to get another label. Only labeling is helpful when it gives you an idea of what tools might be most useful to help understand the whole picture of you. So, I'm so glad you joined me today. Please, if you found this helpful, like, subscribe, share it with someone who you think it might be useful too. Thanks for joining me. I'll see you next time. Take care. Bye bye.